The Ear 1 Endocrinologist reveals the simple daily habit that prevents high blood sugar after 60. I implore you to pause whatever you are engaged in at this very moment, for the insights I am about to impart over the ensuing minutes possess the potential to dramatically reshape the trajectory of your life. This knowledge could very well be the pivotal factor determining whether your remaining years are characterized by vibrant energy, sharp mental clarity, and unwavering independence, or whether you find yourself navigating the labyrinthine corridors of doctors' offices, confronting a relentless tide of cascading health complications. I do not utter these words to instill fear. Rather, they are born from over 2 decades of dedicated practice as an endocrinologist. During this extensive period, I have encountered with disheartening regularity thousands of individuals who sought my counsel at a stage when intervention became significantly more challenging. These were people who, by their own account, felt perfectly well, entirely oblivious to the silent storm brewing within. By the time they presented themselves at my clinic, the insidious damage had already taken root and begun its destructive progress. Therefore, if you find yourself at or approaching the age of 60, and you have ever been informed that your blood sugar levels are hovering at the higher end of the spectrum or are deemed borderline, or if you simply possess a profound desire to proactively avert ever hearing such pronouncements, then I urge you to continue your engagement with this information. Today, I am poised to unveil a singular, remarkably simple daily practice that my most successful and thriving patients consistently employ to maintain a stable blood sugar equilibrium, bolster their metabolic resilience, and ensure their bodies function with the vitality and vigor of individuals a decade to 15 years their junior. My name is Dr. Robert Walker, and I am a board-certified endocrinologist. My professional journey has been singularly dedicated to unraveling the intricate mechanisms by which the human body orchestrates energy regulation, blood sugar balance, and hormonal harmony. More critically, my focus has been on understanding the detrimental transformations that occur within this finely tuned system as we transcend the age of 60. What eludes the understanding of many is that the core issue is not solely confined to the consumption of sugar, nor is it exclusively a matter of dietary choices. Instead, a far more fundamental process is unfolding at the cellular level, a phenomenon that is conspicuously absent from mainstream discourse. And the solution, which I will soon reveal, is likely to evoke surprise, not because it involves pharmaceuticals, costly supplements, or intricate protocols demanding a medical degree to comprehend, but rather because it is an accessible, actionable step you can initiate as early as tomorrow morning. However, before I disclose this revelation, it is imperative that you grasp the profound urgency of this matter, particularly within your demographic. Once the underlying science is illuminated, the significance of this issue will become undeniable and impossible to disregard. Let us delve into the physiological transformations that transpire within your body as the years advance. In youth, your body possesses a remarkably efficient and elegant system for managing blood glucose. Upon consuming a meal, your blood sugar experiences a modest elevation. In response, your pancreas liberates a crucial hormone known as insulin. Insulin acts as a biological key, unlocking the cellular doors, thereby facilitating the entry of glucose, the sugar derived from your food, into your cells to be utilized as fuel for energy. This process is both precise and rapid, and in a healthy, youthful physiology, it operates with an almost automatic seamlessness. However, as the age of 60 approaches and passes, a subtle yet significant alteration begins to manifest. Your cells gradually exhibit a diminished sensitivity to insulin. The cellular lock mechanisms, metaphorically speaking, become more resistant to being opened. While your pancreas continues to produce insulin, its efficacy in facilitating glucose entry into the cells is notably reduced. The inevitable consequence of this diminished sensitivity is that your pancreas must increasingly exert itself, secreting larger quantities of insulin in a desperate attempt to overcome the cellular resistance and drive glucose into the cells. This compensatory effort results in prolonged periods of elevated blood sugar following each meal. Over time, this insidious condition, clinically termed insulin resistance, undergoes a quiet but relentless amplification, ultimately snowballing into a far more perilous state of metabolic disarray. The statistics surrounding this issue are truly staggering, and the first time I encountered them, they brought my work into stark, sobering perspective. According to data from the Centers for Disease Control and Prevention, an alarming number of American adults, exceeding 96 million individuals, which translates to nearly 1 in every 3 people, are currently living with prediabetes. The truly disquieting aspect of this figure is that over 80% of these individuals remain entirely unaware of their condition. They feel perfectly well, continuing their daily routines, blissfully ignorant that their blood sugar levels are incrementally advancing into a dangerous zone. Furthermore, robust research published in the esteemed journal Diabetes Care unequivocally demonstrates that in the absence of targeted intervention, a substantial proportion, up to 70%, of individuals diagnosed with prediabetes will inevitably progress to the development of full-blown type 2 diabetes. This represents tens of millions of people unknowingly traversing a path that leads perilously close to a metabolic precipice, a danger they are utterly unequipped to perceive. The heightened significance of this issue after the age of 60 cannot be overstated. This is because the body's inherent capacity to recover and adapt diminishes considerably with age. When a younger individual begins to experience the initial stages of insulin resistance, their body possesses a greater metabolic reserve and a more substantial capacity for compensation. However, by the time one reaches their 60s, a confluence of physiological changes converges, rendering this condition significantly more precarious. Firstly, there is a natural and progressive decline in muscle mass that has been occurring for years, a process known as sarcopenia. Muscle tissue plays a critical role in the body's glucose disposal mechanisms, acting as a primary site for clearing sugar from the bloodstream. A reduction in muscle mass inevitably translates to a diminished capacity for effectively removing glucose from circulation. Secondly, the liver becomes increasingly resistant to insulin's signaling. This means that even when blood sugar levels are already elevated, the liver continues to release glucose into the bloodstream, exacerbating the existing hyperglycemia. Thirdly, the beta cells within the pancreas, the specialized cells responsible for insulin production, have been subjected to decades of increased workload. Consequently, they begin to exhibit signs of wear and tear, much like an engine that has been running at excessive temperatures for an extended duration. Eventually, their performance falters, leading to a decline in insulin secretion. The repercussions of chronically elevated blood sugar extend far beyond the confines of a diabetes diagnosis. This is a critical understanding I wish to impress upon every individual engaging with this information. Persistent high blood sugar inflicts damage upon the delicate network of blood vessels throughout the body. It impairs the microcapillaries that nourish vital organs such as the kidneys, eyes, and nerves. Moreover, it ignites a cascade of inflammatory responses at the cellular level, thereby accelerating the aging process. Research has established a direct correlation between elevated blood sugar levels and a decline in cognitive function, as well as an increased susceptibility to Alzheimer's disease. Indeed, some researchers have begun to refer to Alzheimer's as type 3 diabetes due to the profound and undeniable link between insulin resistance within the brain and the development of dementia. It further compromises the immune system, rendering the body more vulnerable to infections and impeding the healing process. It disrupts sleep patterns, contributes to pervasive fatigue, and is a significant factor in the unexplained accumulation of abdominal fat that troubles so many individuals over 60, leaving them bewildered as to its cause. In observing my own clinical practice over many years, I began to notice a compelling pattern, an observation that ultimately compelled me to fundamentally reevaluate my approach to patient care. I started to discern a consistent trait among my patients who were over 60 and yet managed to maintain exceptionally stable blood sugar levels. These individuals were not reliant on diabetes medication, exhibited excellent metabolic health, and possessed a physical and mental vitality that belied their chronological age. Almost universally, they shared one specific recurring daily behavior. It was not solely attributable to their dietary habits, nor was it because they were training for marathons. It was something considerably simpler. Driven by curiosity, I delved into the existing scientific literature to understand the underlying mechanisms responsible for this remarkable efficacy, and what I uncovered was a body of research that proved to be profoundly fascinating. Allow me to articulate this practice, and then I will elucidate the scientific principles that underscore its remarkable effectiveness, ensuring you comprehend precisely why it yields such potent results. The habit is elegantly straightforward: a brief walk lasting no more than 10 to 15 minutes, undertaken immediately following the consumption of your largest meal of the day. That is the entirety of it. A consistent 10 to 15 minute perambulation after meals. Now, I anticipate some of you may be thinking, Dr. Walker, I was already aware that walking is beneficial. However, I implore you to remain engaged, because the physiological events that transpire within your muscles and bloodstream during those specific 15 minutes are often overlooked and seldom discussed. Understanding these events will irrevocably alter your perception of this seemingly mundane activity. The science is as follows. Following a meal, your blood sugar levels inevitably begin to rise, typically reaching their peak between 30 to 60 minutes post-consumption. The magnitude of this post-meal blood sugar spike and the zenith it attains serves as a critical determinant of your long-term metabolic well-being. A seminal study published in the journal Diabetologia revealed that even a mere 2-minute walk after a meal was sufficient to significantly attenuate the post-meal blood sugar surge when compared to remaining sedentary. However, when researchers extended the duration of the walk to a more substantial 10 to 15 minutes, the observed effects were even more pronounced. The post-meal glucose spike was effectively reduced by as much as an impressive 30%. Now let us delve into the cellular mechanisms underpinning this remarkable effect. When your muscles are actively engaged, even during a gentle, leisurely walk, they possess the inherent ability to absorb glucose directly from the bloodstream. Crucially, this absorption occurs via a pathway that is entirely independent of insulin. Let me reiterate this point, as it is the cornerstone of understanding why this practice is so profoundly beneficial for individuals grappling with insulin resistance. Your muscles can effectively assimilate blood sugar without the direct involvement of insulin when they are in a state of contraction. This physiological process is mediated by a specific protein known as GLUT4, or glucose transporter type 4. This protein is activated within muscle cells when they are subjected to physical activity. Consequently, during that post-meal walk, the muscles in your legs, your core, and your arms effectively act as biological sponges, eagerly absorbing the glucose that has recently entered your bloodstream from your meal. In essence, they are performing the very task that insulin finds increasingly challenging when your cells have become resistant to its action. This is not a marginal benefit, it is a transformative one. For individuals over 60 who are experiencing a decline in insulin sensitivity, this post-meal walk provides a vital physiological backup system. It activates a secondary mechanism for blood sugar clearance that effectively bypasses the fundamental problem of insulin resistance. But the advantages do not cease with this immediate glucose-lowering effect. There is an additional, and to my mind, truly extraordinary layer to this phenomenon. Research published in the American Journal of Physiology has demonstrated that consistent engagement in post-meal physical activity actually enhances insulin sensitivity over time. This signifies that the more regularly you incorporate this practice into your routine, the more adept your cells become at responding to insulin not only in the immediate aftermath of the walk, but throughout the entire day. You are not merely addressing the symptom in the short term. You are actively working to rectify the underlying physiological dysfunction. A compelling study conducted in New Zealand followed a cohort of older adults diagnosed with prediabetes who integrated short post-meal walks into their daily regimen. After a mere 4 weeks of consistent practice, their blood sugar control had improved significantly. In some instances, the improvement was substantial enough to remove them from the prediabetic classification altogether. Consider this: 4 weeks, without recourse to medication, without undertaking a radical dietary overhaul, simply by consistently incorporating short walks after meals. Furthermore, there exists yet another dimension to this: practice, a subtle benefit that is rarely brought to light by medical professionals. Physical activity, particularly low-intensity exercise such as walking, stimulates the release of a signaling molecule from your muscles known as interleukin-6. While interleukin-6 can sometimes be associated with pro-inflammatory responses in different contexts, its release from contracting muscles during exercise triggers an anti-inflammatory cascade. It signals the liver to enhance its insulin sensitivity and plays a role in regulating hormones that govern appetite and metabolism. Over time, this muscle-generated signaling contributes to a reduction in the chronic, low-grade inflammation that is strongly implicated in insulin resistance, metabolic syndrome, and all the associated complications I previously outlined. In essence, your muscles are not merely passive conduits for movement. They are sophisticated endocrine organs, capable of producing hormones and signaling molecules that communicate with the rest of your body. By engaging in a post-meal walk, you are effectively activating this entire intricate system. I wish to address a concern I frequently encounter from patients. "Dr. Walker," they often say, "what about my joints? I suffer from arthritis, and walking is painful." This is an exceptionally valid concern, and I want to be unequivocally clear on this matter. The walk does not need to be brisk or strenuous. Even a slow, gentle, and relaxed stroll, whether it is around your living room, down your driveway and back, or around the block at a pace that feels comfortable and sustainable for you, is perfectly adequate. The muscle contractions elicited by even a slow walk are sufficient to activate the GLUT4 pathway and initiate the process of clearing glucose from your blood. The scientific literature consistently indicates that it is the act of movement itself, rather than its intensity, that drives this particular health benefit. Therefore, if you experience joint pain, proceed at a slow and steady pace. If you rely on a cane or a walker, that is entirely acceptable. If your living environment presents challenges due to inclement weather, a walk down your hallway will suffice. The fundamental principle is simply to engage in movement for those 10 to 15 minutes within that critical post-meal window. I also want to address another common line of thought that surfaces among patients. "Dr. Walker," they might ask, "I am already taking medication for my blood sugar. Does this practice still hold relevance for me?" The answer is an emphatic yes, and in certain respects, it may even hold greater significance. A wealth of studies has corroborated that post-meal walking can augment the efficacy of commonly prescribed diabetes medications. Among my patients who have successfully managed to reduce their medication dosages over time, under careful medical supervision, consistent engagement in post-meal activity was almost invariably a contributing factor to their success. It is crucial to understand that this practice is not a substitute for your prescribed medication. Never alter your medication regimen without consulting your physician. However, it serves as a potent complementary strategy that enhances the effectiveness of your existing treatment. I would also like to introduce a synergistic practice that can further amplify the benefits of post-meal walking. I recommend this to virtually all of my patients. Prior to your meal, especially if it is rich in carbohydrates, try to dedicate just 2 to 3 minutes to performing some light resistance movements. This could involve a few chair squats, a few wall push-ups, or even simply standing up and sitting back down for 10 repetitions. This pre-meal muscle activation has been shown to improve the capacity of your muscles to uptake glucose in anticipation of the meal's arrival. Essentially, you are preparing your muscles to efficiently handle the incoming glucose even before it enters your bloodstream. Following this brief preparatory phase, you then proceed with your 10 to 15 minute post-meal walk. This combined approach, pre-meal activation followed by post-meal walking, is the strategy I enthusiastically endorse for my patients, and the metabolic data we observe during follow-up appointments is consistently remarkable. To synthesize these findings, it is essential to reiterate the core message. After the age of 60, your body's inherent ability to regulate blood sugar naturally undergoes a decline, primarily due to the progression of insulin resistance, age-related muscle loss, and a gradual reduction in pancreatic function. The consequences of unmanaged elevated blood sugar are far-reaching and extend well beyond the diagnosis of diabetes, impacting the health of your heart, kidneys, brain, nervous system, immune defenses, and ultimately your overall quality of life. Yet you are not rendered powerless in this situation. In fact, you possess a remarkably potent and effective tool that is readily available to you starting today at absolutely no financial cost. A 10 to 15-minute walk undertaken after your largest meal of the day effectively activates a non-insulin dependent pathway within your muscles, facilitating the clearance of glucose from your bloodstream. This practice demonstrably reduces post-meal blood sugar spikes by up to 30%, enhances overall insulin sensitivity over time, and contributes to a reduction in the chronic inflammation that fuels metabolic diseases. It is a simple intervention, universally accessible, and grounded in a robust and extensively validated scientific foundation. Based on my personal observations of my patients over more than 2 decades, it is a practice that undeniably yields results. Begin this practice tomorrow. After your largest meal of the day, whether that is lunch or dinner, put on your walking shoes, step outside if circumstances permit, and walk for 15 minutes. Repeat this the following day and the day after that. Commit to a consistent 4-week period, and I can confidently promise you that you will perceive a tangible difference. Many of my patients report experiencing enhanced energy levels, a more stable mood, improved sleep quality, and a diminished feeling of post-meal sluggishness within the initial 2 to 3 weeks of consistent practice. Your health at 60, 70, and beyond is not a predetermined fate. The choices you make, commencing today, possess the power to exert a genuine and measurable influence on your physical well-being 5 years from now. And this post-meal walk stands as one of the most impactful and empowering choices you can make. If this video has provided you with valuable insights, if it has altered your perspective on blood sugar management and your daily habits, I kindly request that you take a moment to click the like button. It is a trivial action that requires mere seconds, yet it significantly aids in disseminating this crucial information to a wider audience who could genuinely benefit from it. Furthermore, if you have not yet subscribed to this channel, please do so and activate notifications. Each week, I am committed to delivering science-backed, doctor-verified health information specifically curated for individuals who aspire to age with resilience, mental acuity, and unwavering dignity. In my forthcoming video, I will be revealing 5 specific foods that endocrinologists unequivocally recommend for stabilizing blood sugar levels. And I assure you, the 3rd item on that list is bound to elicit considerable surprise. You will not want to miss it. I look forward to seeing you there.